liquid meat, all that saturated fat and cholesterol, and indeed, dairy is the #1 source of saturated fat in the American diet. Right? And aren't eggs like little cholesterol bombs? No wonder they're not doing so hot. Right? They're dragging down the average, right? Separate out the vegans, and then you'll see a little longevity, baby, you know? Well, unfortunately, neither of these two studies separated out the vegans. All right, so where can we turn? Well, this is the latest research, both published and unpublished. What about the best? Well, you know, the best research we have to date is probably this study, published in the American Journal of Clinical Nutrition, called Mortality in Vegetarians and Non-Vegetarians. And what these 12 researchers did was took all the biggest and best studies to date and kind of pooled all the data together. So they took a decade of mortality data from 28,000 vegetarians from Germany, the UK, and California, and found no survival advantage for vegetarians. What about vegans, though? We don't eat all that cheesy crap, and we have even lower cholesterol levels, right? Vegans didn't live any longer either. Same mortality rates as meat eaters. Wow, there must be something really working against vegans if we can die those kind of heart disease rates with such low cholesterol levels, right? Now, this isn't the end-all, be-all. Though it had 28,000 vegetarians, it only had a few hundred vegans. This new EPIC study out of Europe has thousands of vegans who will soon become the best study on vegans in human history. Unfortunately, having seen some of the preliminary data and spoken to the principal investigators over there, there's no reason to suspect that the results will come out any different than what we see right here. And in fact, just last month, the results from the famous German Heidelberg study were released. 2,000 people followed for 21 years, and the vegetarians lived longer than the vegans. And those who ate meat on occasion outlasted them all. All right, before I go about exploring these findings, I would just like to throw up a third finding I'd like to investigate today, and throw up is right. Osteoporosis has reached epidemic levels in this country. 10 million Americans, particularly women, suffer from this disease. Now, if you compare the bone mineral density of vegetarians to meat eaters, it's about the same. Now, in some studies, the bone mineral density of vegans has not been as good, but you know, bone mineral density is only one indicator of bone health. What you also want to know is if someone's actually more likely to break something. So, hip fracture rate has been considered kind of like the gold standard in terms of an indicator for bone health. But since there's never been any studies on hip fracture rates in vegetarians, I don't think we can conclusively say much about vegetarian bone health. Again, we could estimate, right, based on bone mineral density, we're probably doing pretty good. But again, we didn't have any studies on hip fracture rates in vegetarians until now. Presented for the first time to the Congress last year in a study of thousands of California Seventh-day Adventists, vegetarians had over twice the hip fracture rate as meat eaters. So this is the third finding I'd like to investigate with everyone today. Let's start with this, the first finding about longevity, right? Now, this isn't to say we couldn't necessarily live longer, right? Remember our cholesterol levels, our blood pressure and all that. We have a tremendous potential for decreasing heart disease risk, but something is getting in our way. What is it about vegetarian and vegan diets that's increasing our risk of dying so much that it's counteracting kind of all of our natural benefits? Right? What is it? And just as importantly, can we change it? And the good news is, about time for some good news, and the good news is that yes, we think we know exactly what's going on, and yes, with but a few simple changes, not only will we reclaim all of our natural vegetarian advantages, but we may surpass our highest expectations. Turns out there are two major things about vegetarian diets, and we are going to nail both of them today. As an aside, though, I mean, just because we don't seem to live longer, even as we are now with no changes just because vegetarians don't seem to live longer doesn't mean they're not healthier. I mean, vegetarians do have lower rates of obesity, high blood pressure, diabetes, colon cancer, heart disease, appendicitis, the list goes on and on. So it still makes sense to go vegetarian, even if just for health reasons alone. So it still makes sense to go vegetarian, even if just for health reasons alone. But, you'd think with all that, we'd have some kind of survival advantage, right? What is it about vegetarian, and particularly vegan diets, that's increasing our risk so much, it's canceling out our potential? What are we lacking in our diets? What are we deficient in? Well, to begin our detective story quest, one might start thinking, well, what other risk factors are there besides, cholesterol, high blood pressure, diabetes, all that, because we're kicking tush in all those, right? Well, to answer that question, one might ask, well, what interventions have been shown to decrease heart disease risk, right? Not eating meat didn't seem to help much. So what has been shown to help? Well, if you take people who've already had a heart attack and therefore at high risk of having another one, and you put them on cholesterol-lowering drugs, their risk of subsequently having another heart attack and dying drops by about 20%. Right? Yeah, but for those at high risk minus 20% is still high risk. So then they gave people fish oil capsules, dropped their risk of subsequently dying by about 30%. Not bad, but let's just cut to the chase here. I mean, what's the best results anyone's ever gotten? Well, there was this one study in which heart disease mortality dropped over 70%. Cancer death rates were cut in half too. What did they do? Researchers were sitting around one day in France looking at heart disease data, evidently something researchers do in France. They were looking at a graph of heart disease mortality versus cholesterol levels. And not surprisingly, the graph looked like this. Right? The more cholesterol you have in your blood, the higher your risk of dying from heart disease. We've known about this forever, right? So let's say this is data from the United States. Now, but when you did this exact same thing, but charted people who lived in the Mediterranean region of Europe, you got a different graph. You got this. Now, notice same relationship, right? I mean, the more cholesterol you have in your blood, the higher your risk of dying from heart disease. But check this out. At the exact same cholesterol level, those living in southern Europe around the Mediterranean have much lower rates of heart disease. Well, that's kind of weird. So they said, what the heck? I say what the heck in French, but they took these 600 heart patients and put half of them on a Mediterranean diet and put the other half on a so-called American Heart Association strict prudent step 2 diet in what was to become known as the famous Lyon diet heart trial. After just 2 years, the survival benefit was so extreme in the Mediterranean group that they had to stop the study prematurely. An ethics committee came in and said it was just too unethical to keep feeding people the American Heart Association diet because there were so many more deaths in that group. And the results appeared quick, too, the survival advantage. After just 1 year, you could already see the results, whereas in those cholesterol-lowering drug trials, it took like 3 to 4 years to get that wimpy little 20% benefit. And now, after 2 years, 70% drop in cardiac mortality? Wow. All right, so researchers took blood from everyone, analyzed their diets, trying to find out what it was about this diet that had such a magical effect. So we have the Mediterranean group. And the control group. So well, the first thing they did was looked at cholesterol levels. Right? After all, cholesterol is the single biggest risk factor for heart disease, and found that after 2 years on this American Heart Association diet, their average cholesterol was 239. What's your cholesterol supposed to be? A lot less than that, absolutely. Whereas in the Mediterranean group, after 2 years on the Mediterranean diet, their average cholesterol was 239. Exactly the same. Wait a second, 70% less cardiac mortality and the exact same miserable cholesterol? What's going on? So they looked at everyone's diet. What were these people eating? Right? Was the Mediterranean group eating a lot more fish or something? Isn't that supposed to be good for your heart? Well, no. The Mediterranean group was not eating significantly more fish. What they were eating more of, they were eating more fruits, more vegetables, more beans, more whole grains, less meats. Well, wait a second. We do that. We don't have 70% less cardiac mortality. What's the deal? Well, digging a little deeper, they think they've found the deal. One of the most significant differences between the Mediterranean group and the control group was what's called an omega-6 to omega-3 ratio. The omega-6 to omega-3 ratio